So in this chapter, we're going to cover a lot of details about how bone becomes actual bone from a protein model. Or is it just going to be a thin sandwich type of bone that really doesn't need much strength? Who carries a bunch of stuff on their head? You know, maybe some cultures might do that, but for the most part, the skull does not need to be that, you know, based on strength, right? It is a barrier to the brain, yes, but it's the arms and legs that carry most of the load that we pull in life. So arm and leg bone needs to be very, very, very strong. Wouldn't you agree? Right? And your spinal bones. So bones that are designed to be strong, to hold weight, to do things, right? We don't really do anything with our head for the most part, right? But bones that are designed to be strong, to do things, to do work, need a little bit more careful time to design, careful time to make, and the whole ossification structure of it. That's what I'm trying to get to. So the bone development of the skull and sternum is going to be really quick, really easy. The bone development of what we consider to be a long bone and some of these irregular bones that are thicker, like the spine, those take more time and they're going to need more resources, right? So we'll see those two play out. Then we're going to see metabolism of bone. This is going to be hormonal and physical. So that just means that in order to maintain bone, we have to have physical force upon the bone. We have to use the bones. If we don't use the bone, then we lose the bone. Think about it from a design perspective. If the bones were designed to be strong, to do work, that statement means a lot. Then if you don't do the work, you're not using the design of the bone, therefore the bone goes away. So when you don't use your bone mass to do work, you lose your bone mass, basically. If you go float in space for a few months, you're going to lose your bone mass because the bones are not being used. There's no stress upon the bone. That's the physical stress. The hormonal balance of bone is that of calcium and phosphorus. These are the minerals that harden or keep the bone hardened, right? And then from there, we'll get into some, just a little bit of pathology. So we'll see osteoporosis versus, just as a couple of examples, there's certainly a whole, you know, there's a whole library of bone pathology, guys, which we're not going to do. You won't see that till you go to medical school or something. But just two quick examples, osteoporosis versus osteomalacia. You want to see how those differ. All right, so to start, this slide just shows us a little preview of what it takes to make the inside of a bone. This is what we consider a typical long bone, guys. You're looking at pieces of cartilage that slowly develop. They become infiltrated with blood vessels. Those blood vessels will be carrying calcium and phosphorus to what we say mineralize the bone. When we say mineralize, we mean to harden the bone. And then when we look at a mature bone here on the bottom, we see that a typical long bone, because that's where we're going to spend most of our time talking about long bone rather than skull bone. In a typical long bone like this, it's like a little city. They have certain units, like you consider that like a little neighborhood, right? In that neighborhood, there are certain supply lines right in the middle, the artery and vein coming right through the middle. That's going to supply all the nutrients for that little miniature city of the bone, okay? So we'll name all these parts of the bone. That's just a little, you know, introduction of it. There's lots of terms. Every chapter you come to, guys, in A&P, you're going to be covering just probably, you know, at least, you know, 50 new terms. It's just insane. So a lot of this is going to be vocabulary, just getting used to hearing it. And that's why I'm suggesting you guys do work on your own at home. Because hearing 20 new terms a day from me only produces anxiety. When you go home and then digest maybe just 5 or 10 of those terms on your own, then when you come to class next time and I mention them, it's not so scary, right? You thought about it at home and it seems more tolerable. But if you never do anything at home, you're just going to be compounding 20 new terms a day every time we meet, and it's going to be too much to catch up with. So please, please, please do some work like tonight or over the next couple of days. Promise me, guys, by the time we meet again on Thursday, you would have looked at the anatomy of bone for sure, right? And that you know it very, very well. This is what I'm expecting of you. In college, we don't have near enough, scheduled homework assignments as you might have in other, other education, but we just kind of leave it to you to do it. There is homework. We just don't basically call it all the time homework, but if you want to call this homework, your teacher is giving you an assignment to, you must know, there you go. I'm going to use the word must. You must know the anatomy of bone by next class. That's your homework. Here's the two main divisions, guys, axial and appendicular. The axial skeleton, this is the divisions of the skeleton. Axial is going to be everything in the center. So the center axis, you could say, of the body. So we're talking about the skull, spine, sternum, and ribs. That is your axial skeleton. That's what we're doing today in lab. Skull, spine, sternum, ribs. Just that part. Everything appendicular is everything that's not skull, spine, sternum, ribs. It's going to be your arms and legs. So appendicular is really talking about the appendages, the attachments to the axial skeleton, which are, just in short, your arms and legs. And then of those, we can categorize some of these bones. So I can say that all of this right now, everything that we're talking about right now, the divisions and the types of bone here are all possible test questions for sure. That's why we're going over them. So a long bone would be those that exist in the arm and leg because they're long. Anytime a bone is long or categorized as long, it means that we're talking about the long axis of the bone, right? It's longer than it is wide. So the width is like this, but the length is like this, so we call it long. Even the finger bones, they are longer than they are wide. So even the finger bones are considered long bones, which is odd because you want to call them short bones, don't you? But don't do that. They're not short bones. They're all long bones. The short bones are going to be those in the wrist and ankle. Those short blocky bones, those are your wrist and ankle bones. And then anything irregular would be like a spinal bone, a vertebra, or the hip bones, or the clavicle in the back, or excuse me, the scapula in the back, the shoulder blade. Those are all irregular bones. The flat bones are going to be the really, really thin bones like the sternum and the skull.
So is a long bone or a long bone appendicular?
Yeah, long bones are appendicular, yep. Mm-hmm. Except for the short bones are also, appendicular of the wrist and ankle. Another irregular bone would be the patella. That's actually considered a sesamoid bone, but it's still irregular. Okay. So basic functions here. It's a framework. All bone is a framework for muscles to attach to. They obviously protect because we can consider the skull protecting the brain, the vertebra to protect the spinal cord, the ribs to protect the heart and lungs, so to speak. So it is basic protection, right? Attachment for muscles. Here's a big one, guys, mineral storage. Think of bone as a bank of calcium and phosphorus. So certainly know these two minerals right here, calcium and phosphorus. This is what hardens the bone. So every bone must have a certain degree of calcium and phosphorus, yes, to maintain its hardness. When you lose the hardness of bone, and bone becomes what they say is soft, even though it's not soft to the touch, guys, it means that when bone is without these minerals, it means that bone can bend. Have you ever seen someone's legs that are bowed like this? That's a condition where the bone is demineralized, which means it lost minerals, and the weight of the body makes their legs start to bow, right? So that's a softened bone. That's what osteomalacia is. When your bones kind of bend because they're not hard enough. Where a bone has lost its density, its thickness, right? Where it can fracture really easily, that's osteoporosis. So there's a difference.
Osteomyelitis is where the bone bends.
Bends, right. And osteoporosis when the bone breaks. Because it has no density in it, no thickness. Okay, for the acid-base balance, this will be something you might talk about more in AP2. That's not a big thing for me right now. Certainly the calcium and phosphorus. Is it underlined? Yeah. Darn it. It sure is. I wonder what that means. Triglyceride storage. This means that there is some fat storage inside bone, amazingly. And then lastly, hemato and hemopoiesis. These are two terms that point to blood cell production. I was just talking to my little cute 11-year-old the other day. And he finally found out, I think, in school that blood cells are made in the bone. He just couldn't believe it. He was all excited to tell me. So yeah, blood cells, your red blood cells, your white blood cells, and there's a whole crap load of white blood cells, guys. You'll learn in AP2 if you haven't learned some already. These are all produced in the bone, in the red bone marrow. So yeah, that's very important. You got roughly, guys, about 5 million red blood cells circulating. Where do you think they came from? From your bone. Your bone marrow is incredibly important to build these blood cells. So red blood cell production, I'll tell you real quickly, red blood cell production specifically is hemopoiesis. All blood cells is hemato. Hemato is a much bigger scope. These are all blood cells, white and red. Hemo is just the red. So whenever you go to a hospital and you go to the lab, sometimes you'll hear the word hematology. That's just the study of blood, basically. If you've heard that word before. So hemo is always going to be pointing to blood. All right, so here, quick trip down some function here. Cartilage, its function is to protect the bone. Ligaments will connect bones together. So cartilage protects bone, ligaments connect bone. Tendons will be what joins muscle to bone. So in short, ligaments join bone to bone, tendons join muscle to bone. Think of a chicken tender. Unless you're vegetarian. Don't take it back. Chicken tender is muscle, right? With a tendon on the end. Sometimes. Think of that. So you won't ever forget it. Tendons are a muscle, how muscles attach to bone. Ligaments, bone to bone. Cartilage is there for protection at the joints. So anytime, this is going to be something we'll need to keep in handy for the end of the unit when we do the joint chapter. All joints that freely move. You can see my movement here, right? Got plenty of, right? Used to be a break dancer in the 80s. I've lost all my groove though now. Just don't have it. It's gone. I don't know where it went. It's gone. My whole days used to be spent dancing like for 5 hours. Can't imagine me doing that now. What's the purpose? When you're older, you don't see a purpose in dancing, really. I don't know why. Anyway, any joint that moves will have to have cartilage. You have to have cartilage to protect that movement. Otherwise, it would wear down the bone. So when we go to joint chapter and we learn certain joints that move versus joints that don't move, all joints that move must have cartilage, right? Do my joints in the skull, do they move? No, they don't. Can anyone open their skull? Yeah, unless you're in Stranger Things. What's that thing called where they open up the skull? I don't know what it's called again. It's been too long. But yeah, skull bones, they don't move. Therefore, there's no cartilage in the skull joints. That's something easy to remember, right? Instead of memorizing it, it's just notable to remember that. What's that?
Osteoporosis was for vitamin.
Osteoporosis,
No, hemopoiesis.
hemopoiesis is for red blood cell production.
Red blood
Yeah. Yeah. Okay, so here we're just talking about mineralization means to harden the bone. There can be what's considered calcification, but what we want is mineralization. Mineralization is the normal term used for healthy, adding calcium to the bone in a healthy manner. Calcification is when calcium can just be added anywhere, which we normally don't want. That's just an explanation there. There is a just a review of your bone types. So see, that's a beautiful study goal right there. 5 minutes out of your life to make sure you can get this. And how do you demonstrate it? You don't just read it. You don't just highlight it. You don't memorize it and go like this. You take a blank sheet of paper after you're done studying and prove that you know it. That's how you know it. And if you get it wrong, then do it again, right? Far too often we cheat ourselves by peeking at our notes and thinking that we're studying. If you don't know it, if you can't write it down, then you don't know it. Or maybe just talk to someone and, you know, FaceTime your favorite friend and tell them, hey, you know what the short bones are? And they say no, and you're gonna say, well, I'm gonna tell you. It's the wrist and ankle bones, right? And they're gonna say, damn, that's pretty cool. Yeah. You gain a new friend like that. Or lose a friend like that, right? Yes, definitely. Hey, you want to celebrate the friends that you lose. You don't need them anyway. If they don't support you fully, just easily say goodbye. All right, so this is just an example of how bone looks on X-ray. Any guys going into rad tech? Yeah, it's so interesting, so interesting. Radiography guys, anything that shows up dense like bone means that it blocked the photons that were coming out of that machine. So really you're looking at a shadow. So if I hold my hand up, right, to this light source, that's visible light, so you can see it. X-ray photon is a non-visible light wave. That's why they do that, you know, discovered it, named it X, because he was like, oh, geez, I just discovered a light wave. What do I call it? I don't know. Let's just call it X. Why not? Since X is a variable, yeah. Anyway, bone density is just a shadow to an X-ray photon. So anything that has dense, or what they call radio density, is going to show up kind of a bright white. If this were osteoporotic bone, guys, or bone without minerals, bone without any kind of density or minerals, the photon would go right through it and it would show a darker bone, or excuse me, a lighter, like a medium shade is what I want to say. So a thing that has density will show up bright white. Thing that does not have density will actually show up dark. So when you X-ray lungs, it's mostly air. Lungs show up black on X-ray. They literally show up black. And people think, oh, Jesus, where'd my lungs go? They're black. That's normal. Lung fields should show up. Air shows up black. So when you look at gas in the colon, like people look at their own X-ray, oh my goodness, look at a big old black thing of nothingness right there in my colon. That's just a bunch of gas, right? It's naturally going to be there. You want gas in the colon, actually. That's a good sign. Anyway, so radio opaque and radio density is what bone is going to be. Radiolucent, those terms are going to be where it goes straight through the bone. So lucency is where air is. In this case, tissue is mainly water, so it's somewhat lucent. What is very lucent is in the black background. That's where the X-ray photon exposed the entire film. That's why it's black. There's nothing blocked it, basically. All right, so that's just a little something about that. Here we go, guys. We're going to put some terms now to compare compact bone versus spongy bone. Compact bone will be that which is the toughest, right? The most dense. Spongy bone is still strong, but it's got a bunch of holes in it, so they call it spongy or cancellous bone. We're going to say that the orientation of compact bone is what's called an osteon. These are the units that make up compact bone. So word association, guys. compact bone, osteon. For spongy bone, the orientation is going to be known as trabeculae. So we're going to make some easy associations here. I'm going to put them on the board. As we go, this is part of your anatomy of the bone. We're going to say that compact bone is mainly made of what's called osteons. Spongy bone is made of what's called trabeculae. That's the what we say the orientation of it, the framework of it. Maybe that's a better word. So the framework of compact bone is a bunch of osteons. The framework of spongy bone is trabeculae. So guess what? If you get any questions about trabeculae, what are you thinking? Spongy bone. Get any questions about any osteon? You're thinking compact bone. So where is compact bone? It's mainly what we consider the diaphysis of the bone. Whereas spongy bone is mainly more at the epiphysis of the bone. This is going to be some word association that we'll see in the coming pictures. The diaphysis, guys, if you look at this marker you can say, the diaphysis is going to be the middle, longer part of it. The epiphysis is going to be the edges. So think of epiphysis meaning the edges, top and bottom. So where do we find spongy bone? More at the top and bottom epiphyses. And where's all the compact bone? Going to be in the main, what we call the shaft, which is the diaphysis, the longer part of the bone. I'll put a picture up to make sure you can see it. And then we're going to convert that to, okay, what kind of bone marrow do we normally see in these regions? Well, in the epiphysis region is where you will normally find the red bone marrow. In the diaphysis region is where you're going to find the yellow bone marrow. So what kind of bone do you find among the red bone marrow? Spongy bone. What kind of pattern do you find around the red bone marrow? Trabecular pattern. At what location of the bone do you find the red bone marrow? Epiphysis. You see how all these relate to each other? And just a number of types of test questions that can be thrown at you. That's why word association is so powerful. You're going to find osteon type arrangement in compact bone found at the diaphysis, which is going to be protecting the yellow bone marrow. So they all kind of flow together. If you learn the words that belong together, it can help you with many types of questions. Instead of you learning a bunch of definitions, it's just nice to know the association of all these words. Okay. So these are just different features. We'll come to some of these later. They're not really important right now. I'm going to show you the picture. It'll be more relevant to see the picture. But yeah, articular cartilage, that's the cartilage I was mentioning that we need to protect the bone. This is going to be what's called hyaline cartilage. If you want to jot that down, it's Hyale, like line. Hya line, hyaline cartilage. This is the cartilage that you find in all your joints. Therefore, it's called articular cartilage. Anything articular is joint. Hyaline cartilage.
So articular and opposite.
Articular is hyaline cartilage. You got it. Hya, yeah. Line. So how do you learn that? You say it enough, and one of the best ways to do that, I'm gonna press this upon you a lot. When you learn bones and muscles, guys, is not just to see it on a picture or see it on a page, it's to point it on your body. All right, if you can name every muscle as you point it on your body, that is the most powerful way to learn. It really is. It's better than looking at pictures. Because guess what you got with you on the test? Your lovely body, right? If you can name, if you study knowing all the muscles on your body and your brain is cultured to that, then as you're moving around, you just say you have your own little study guide with, right? It works. Anyway, where's articular cartilage? Well, where's your joints? There's articular cartilage, there's cartilage, there's cartilage, there's cartilage, there's cartilage. Every joint you're gonna have this articular cartilage. Everywhere that needs protection. Okay, so here's our typical long bone, guys. Look at where that red bone marrow is. At the epiphysis on both ends, top and bottom. It just seems to be more present at the top, the proximal edge of the bone, I will say. Right? But you've got red bone marrow at both edges. You've got spongy bone at both edges, which is the epiphysis. You've got compact bone here in the middle, what's considered the diaphysis, the shaft of the bone. So that's why I gave you that word association. So yellow bone marrow exists in the center of the diaphysis. Red bone marrow exists in the center of the epiphysis, right? Which type of bone is around the red bone marrow? Trabecular bone, spongy bone. Which type of bone is around the yellow bone marrow? Thicker, denser, compact bone, right? See the association? Once you see it enough, you get the terms right. This is good if you're putting all that together. A couple of things that we need to talk about would be what surrounds these edges, what surrounds the epiphysis, the edge of the bone, is that cartilage, the articular cartilage. So now we can write that one down. You can say around the spongy bone, right? Around the epiphysis, you'll have articular cartilage, which is our hyaline cartilage. Around the diaphysis, we will have periosteum and endosteum. And let me show you the difference. The periosteum is on the very outside of the bone. Think of it as if you had a straw, the straw wrapper around the straw, right? The wrapper would be the periosteum. It's around. That's what peri means, around. Periosteum is a thin tissue that sits around the outside of the bone. Whereas the endosteum is a little thin tissue that exists on the very internal lining of that cavity that we see here on the inside of the diaphysis. So endosteum's on the inside, periosteum's on the outside. And you can see the cavity, right? Where the yellow bone marrow would be sitting in. That cavity is called the medullary or marrow cavity. So there's a lot. When I say anatomy of bone, guys, this is it right here. This is what you need to work on. You may not get it all right now, but this is what I need you to work on for by the time you come back for Thursday. Can you label everything, basically? Can you label the red, the yellow, the spongy, the compact, the diaphysis, the epiphysis, right? Do you know where the cartilage is? Do you know where the periosteum is? All these things. Again, periosteum is on the outside. Endosteum is going to be on the inside lining of that cavity. And it's the yellow bone marrow that sits in that cavity. The cavity is called the marrow or medullary cavity. So yeah, lots to look at here. I think I have one of my old drawings, if it helps, yeah, it's not that great, but if it helps to categorize where everything is, I color coded it to try to help you. I know it's not the neatest. Oh, go ahead.
What is the endosteum?
What's that?
The endosteum is part of
The endosteum, yeah, the inside line. Right. You see that in the orange?
Yes.
It's yellow bone marrow in the orange. I don't have the yellow marker.
Oh.
And you see the green? Yeah, the green is the inside line. So maybe there's got to be one person in this class that has like incredible artistic ability maybe you guys could take a moment and draw one real nice and send it to me. I'll send it to everybody or put it in the PowerPoint, whatever. 'Cause that's about the best I can do. I'm not an artist. But yeah, notice we got the articular cartilage in the blue. On the outside of the bone, looks like a little fro. A little more like a hairpiece, actually. That's where the cartilage is going to protect the bone. Why do we need protection at the end of the bone? Who can tell me? So it can join with another bone. Yeah. So just think of your fingers where they're joined. You're going to have cartilage at those joints right there. That's to help the movement. Therefore, if we go backwards, if we don't move our bones, what happens to the joint material, the cartilage? We lose the cartilage, right? And that's what's called arthritis. So when you don't move your bones, you lose the cartilage, then you get arthritis. So most people think, oh, I have arthritis, so I can't move my bones. Well, that's true. But you've got arthritis because you didn't move your bones enough. If we're talking about the right kind of arthritis, there are some other arthritises that are just inflammatory that are really dangerous, like rheumatoid. That's a tough one. But same thing in the spine. You know, people say, those chiropractors, they're not really doctors. You don't really need to get adjusted. You don't really need to have your spine moving. If my spine needed to move, my medical doctor would have told me. Right. Because your electrician is going to tell you about plumbing problems, right? Yeah, I thought so. No, you do need to get your spine moving, just like you get your teeth. That'd be like your dentist saying, just brush them a couple of times a year. That'll do you okay, right? It's the same thing. You definitely need to have your spine moving on a regular basis. You don't need to get adjusted every day, of course, but get your spine moving so that all the bones move to keep the joints happy. Therefore, you don't get arthritis. Has anyone ever woke up stiff in their, in their back? Well, if you're waking up on a trend of stiffness, especially in your older years, that means you have some mild amount of arthritis going on, because that's why it's stiff, right? The cartilage is thinning out. So how do you fix that? You get your spine moving. That's how you fix it. Drugs ain't going to do nothing to that. That's for sure. Unless a drug can have some microbots in it to go in there at the joint and make your joint move. Maybe that'll be invented one day, but movement is what helps the joint move. I had this one patient, she told me that she went to this seminar and she purchased a bottle of pills like for $80 because they told her that's going to move her C1 bone into the right place. I'm like, oh my gosh, how do I politely tell this patient she got ripped off, a pill that's going to move her cervical bone? That's not going to happen. Yeah. So, but yeah, there you go. So yeah, study that picture, know the terms as they associate to one another. Let this be one of your major study goals, because it's a major part of the chapter. I mean, look how many things are labeled. The one term that's not so much presented in your book is this metaphysis region. That's just a transitional region where it starts to widen out to form the epiphysis. And then I did not mention this, the growth plate. Two new terms here, a growth plate and then your epiphyseal line. Let me tell you about that real quick. Growth plate is where your bone still grows in length up to about age 21. So you're going to have them at both ends of the bone. But I only drew it differently at the bottom to show you what it looks like when the growth plate is closed. When the growth plate has stopped growing, let's say you're age 28, right? Your bone growth has already done what it's going to do. When that bone closes, it's going to be called an epiphyseal line. When it's open for growth, it's called an epiphyseal plate or growth plate. When it's closed, no more growth, it's an epiphyseal line. And I drew it black because it's going to show up more dense on X-ray, even though density is white on X-ray. In this, I had to redo the contrast on this. So epiphyseal line will be fully fused bone which shows up brighter white on X-ray if you really want to know. Just like compact bone will show brighter and denser, the epiphyseal line will be. So to say this correctly, on X-ray, the growth plate will look actually clear because it's all cartilage. The same cartilage that's up there that shows up clear because you can't even really see cartilage on X-ray. You can somewhat see it if you know what to look for, but usually you can't see it. So growth plates will be clear basically on X-ray. So when you're X-raying someone young, you'll see like a little sliver of clearness across the bone. That means their growth plates are open. Just like a fracture. If you're looking at a fracture of a bone, you'll see a nice, clear, zigzag line depending on the fracture, showing a break in the mineralization of it. Okay, so we'll get back to the growth plate idea. But anyway, to show you one growth plate being open, which is cartilage, the growth plate being closed, which would be fully fused bone. All right, so we'll get as far as, I think, some of the osteon information, and we'll switch over to our lab info. This is just some other review slides, guys, showing that where would the articular cartilage be? At the epiphysis, the end of the bone. What type of cartilage is it? It is hyaline cartilage, right? We're going to see elastic cartilage in the ears, but the hyaline cartilage, the cartilage is basically all around the body, all the joints. That's the one we're mainly talking about in this chapter. There's a good shot of our periosteum, guys. Think of it as a sleeve around the bone. Calling Perry. Perry is best friends with Sharpie. You got to make your mind a little circus to remember some of this stuff. Perry and Sharpie, they're best friends. Where do they hang out? Around the bone. Sharpie's fibers or other, it's all protein, guys. These are all just connective tissues made of different proteins. Everything's protein, you'll find. Protein and water. These are just certain protein fibers that attach the periosteum to the bone. And then soon enough, you'll learn that bone is actually protein that just became calcified. So we're looking at a big protein party here, right? How do we build proteins? From DNA, right? To RNA, to protein. So when you look at your whole body, yeah, that's how you became to be. There's a whole bunch of protein synthesis. But yeah, all this, guys, everything you're looking at, all this hardened bone, all this, these little round circles are called osteons. That was all protein, all water-based protein at one time that became mineralized. How did it become mineralized? Well, the calcium got into the bloodstream, came up these blood vessels, and then spilled out basically into the bone to harden. And we're going to see some of the cells that control that, but that's how it does it. If you never knew that bones have lots of blood vessels, they sure do. Bone has a lot of blood going through it. That's what's called vascular. It has high vascularization. So that when you break, has anyone ever broken a bone? When you break a bone, don't you see a bunch of bruising come out under the skin? All the different colors that you see, that's pretty much diagnostic for a bone break, is the range of colors that you see. That means you spilled out all those broken capillaries, spilled out all the blood under the skin. Yeah, I've broken. Well, after I was a breakdancer, I was a skateboarder. So I broke lots of bones. In most of them, 80%. It was all stupid showing off for some girl, probably. It's just that dumb. Never pays off to show off. Anyway, the one good thing is that I got a Happy Meal. I loved Happy Meals back then. Because they were quite happy back then. Only like $1.99, or 99 cents actually when I was in high school. Can you believe that? Anyway, which was way back. Who can guess when I was in high school? What year? Anybody have an idea?
And,
Pretty close. I graduated in '87. Yeah. Amazing. All right, so for flat bone, guys, this is membranous bone. This is our skull bone. It has spongy bone, of course, in the center of it. Now, when I say spongy, it's not actually spongy, it just looks like a sponge. But the special word for spongy bone and flat bone like this, as opposed to a long bone, is diploid. So this word belongs to spongy bone of the skull. And, you know, to me, or maybe it's just because I'm a guy, that kind of looks like a sandwich, right? So think of this as membranous or sandwich-like bone. It's got two thin layers of compact, but it's mainly spongy. Or if you're really creative, it kind of resembles a cell membrane. So that's why I like to think of it as membranous bone. Because when you hear the two words endochondral or intramembranous bone development, endochondral or intramembranous, these are two big words, I guess, if you haven't heard them before. Which one sounds more like membrane? The intramembranous, right? So intramembranous ossification, bone development, belongs to the skull. Everything else is going to be endochondral. So that makes it real easy. How do you make long bones? Endochondral ossification. How do you make skull bone? Intramembranous ossification. So just having a reasoning behind it could help. Here's another good shot of it. There's all the trabecular, look at all those spicules, they call them. This would be filled with red bone marrow, but that's what trabecular bone looks like. It's got holes in it. That's our spongy bone. That's actual bone, by the way, of all the pictures that we see. This is actual bone that we're looking at. All right, these are the regions that we see our red bone marrow. Like I said, we see it in the head of the femur humerus, which is the epiphysis of the femur humerus, the proximal epiphysis. We see it in the hip bones and the flat bones. These are the primary areas for red bone marrow. Okay. About 5 more minutes, guys. We'll take a break and switch to our lab content. We're going to look at the anatomy of the osteon, and we'll probably give it a stopping place right there. So notice how much time we spent on this spongy bone of the skull. Just a little bit, just a couple of terms here. Know that flat bone is the skull, that the spongy bone is known as diploid. We said it's primarily made from intramembranous, which will come up on a different slide, actually. But not much to know about flat bone. A good bulk of our time will be spent learning more about the long bone, like I said from the beginning. And these are all the terms we need to know for the osteon. We're getting into these cylindrical units right here. This is one osteon. But go back to the other slide just to give you this. Among this picture here, look at all the osteons that we see. See all these circles? Like little miniature cities or neighborhoods within the bone. We're going to be studying one osteon and we're going to see what's all inside of it. So when you think of osteon, are you thinking compact bone or spongy bone? You're thinking of thick, dense, compact bone. This is going to be the stronger bone, the bone that takes all the weight, all the support of the body. We're not supporting much with the skull, right? We're supporting with all the long bones here in the skeleton. So that's why the anatomy of the osteon is more, diverse. In the spongy bone, we just had a bunch of trabeculae, spongy shaped bone moving around. That's basically it. That's all you got to know. But for long bone in the diaphysis region where we see compact, this is the terminology you need to know. Every osteon will be composed of rings. This is where the terms get really heavy, guys. These rings of collagen, again, protein, they're going to be calcified, yes, but the rings themselves are called lamella. So if I draw an osteon that looks like this, right, vertically, if I make it look like this, and I show you the rings, think about when you cut a tree, right? What do you see inside the tree? You see these rings, right, of development. Same old thing. So we're going to have that center ring and then many rings around it, just like a little, honestly, like a little miniature solar system. It's pretty darn cool to think the structure of your body, the structure of the framework of your body is the framework of the universe. That's weirdly kind of cool, isn't it? Well, each of these rings is called a lamella. So there's a lamella, there's a lamella, there's a lamella. What are the lamella? Rings of collagen. Protein. That eventually get hardened, right? With calcium. Canaliculus. This is plural. A canaliculus is going to be a little canal. See the word canal in the word there? With an iculi added to it. So these canaliculi are these crooked, they look like little cracks, little canals that connect one ring to the next. Right? If you see the logic in it, then it's a whole lot easier to learn. These little canals connect one lamella to the next, right? Like little drainage systems. So canaliculus is singular, canaliculi is plural, as it is on the screen. Small canals that connect the lamella. So what are you going to do when you study this? You're going to read it, you're going to try to understand the terms, but you're also going to get a sheet of paper. You're going to draw it, just like I'm doing. The singular is canaliculus. That's the plural on the screen, yeah. But you're just going to see it written. You're not going to have to write that down. You won't have to see this in lab. No, you don't have to write it down. Okay. Then we're going to have another canal that's in the center. What's it called? The central canal. It's also called the Haversian canal, yes. Haversian, yeah. But where do you think the central canal will be? Look at that, right there in the center. Oh my God. Can you believe it? So creative, right? That's like the easiest thing ever to be named. Central canal is in the center of the osteon. What we're going to see in the center is the blood vessels nerve come through. Think of this as the central, hub of nutrients coming into the osteon. If you've ever seen a neighborhood development, where they have these huge power lines that are coming into the ground before they build the houses, have you ever paid attention to all that development? This is the power, right? This is the nutrients for each osteon, the blood vessel and nerve coming through. In anatomy, they call it the vein, artery, nerve. Little group. They always travel together. The vein, artery, nerve. If you ever dissect the human body or anything else, you'll see vein, artery, nerve travel together. Yeah, the canaliculus will take you to the central canal, yes. In reality, we're starting from the central canal and coming out, to be honest. It can go both ways, though, because you have arteries coming through other ways. Okay, then we got one more canal, the Volkmann. So 3 canals, guys. A canaliculus, a central canal, which is easy enough. Volkmann Canal is in a different perspective. We kind of have to back up a little bit. This is too microscopic to see the Volkmann. So we're gonna kind of zoom out to see where the Volkmann is. But here's a Volkmann. If I have two ostions next to each other, there's a Volkmann. It's gonna connect one ostion to another. So it's a bigger canal. But that's how you get ostions communicating with each other. So if you have a test question about the Volkmann, what's the Volkmann do? It connects one ostion to another. One central canal to another, you could say. What does the canaliculus do? It connects each lamella to each other. And the central canal provides all the nutrition, right, for that one ostion. So if you learn it where it makes sense, then you'll find yourself not having to memorize so much. It's just all, appreciation of design. And there again is that, whoops, wrong way. There again is that vein, artery, nerve traveling together in the central canal. Here's a good picture of the Volkmanns. Can you find them? There's an osteon right there, right? Central canal. There's another osteon right there. So going sideways is that Volkmann. There's another Volkmann. There's another Volkmann. So the Volkmanns go perpendicular, to the osteon. Cool. All right, that's our anatomy, guys. So when I say anatomy of the bone, there you go. We just spent an hour covering the first objective. So that's why I said you're gonna want to spend some time over the next couple of days. And it's not hard. The hardest part is just getting used to the new terms. And that's going to be for every chapter that you do until it really that's that way for the rest of your life. Is you'll learn new things in the field as well. So you just can't be scared of new words. You just got to learn them a little bit at a time. That is the biggest thing I see people, miss out on. They sacrifice all of their happiness and integrity. They substitute it with fear because they get scared of all the new words. So it makes them not study. Well, that's just not gonna work out. You need to attack it and then choose a way to pick a strategy. If 10 terms mess with your head, you just can't do it, then learn 3 terms, right? And when you learn those 3, learn another 3 the next day. Always have a starting point at some point, some way. Otherwise, you're never going to get where you want to go. You just have to do it in some way. And it does get easier as you move along. There's another picture of the Volkmann going across. The little cracks that you see in the bone, those are actually the canaliculus. They look like cracks, but they're little canals. And then the last thing I'll say is that living in each of the layers is an osteocyte. That's actually the bone cell. So every bone cell will have its own little neighborhood, a lacunae to live in. But you should know what a mature bone cell is called. It's called an osteocyte. Osteo means bone, cyte means cell. They live in the lacunae, in the lamella, in the osteon, in the compact bone, in the diaphysis. You gotta wiggle your way back up to the surface of water here. Right? Try to get your perspective of where you are. How do you communicate as an osteocyte to your neighborly osteocyte in the next lamella? How do you give nutrients? How do you share nutrients? Through the lamellae. Where do you get the nutrients from? The central canal, the central hub, right? Which might have got its nutrients from one of those Volkmann canals. The Volkmann canals, notice where they come from? They communicate with the outer part of the bone where the arteries come to the bone in the first place. So it's an intricate little, weaving of circulation to get to that central canal from the outside of the bone. But there you go. That's our anatomy of the bone, guys. That's actually a microscopic slot of bone. So later on, when we do tissues in unit 4, you'll see this again. But there's your dried up blood in the center there. Every one of these little black dots is an osteocyte. All the cracks that you see are the many canaliculi. But that is one osteon that we're looking at. Well, there's 3 total, but one in the center. All right. Cool. Okay, we'll do this next time. All right, guys, so that's where we're going to stop here for that information. Take a quick break and we'll come back and do some lab work. So anytime you're in class, don't leave lab until you know you have labeled on the model what you need to be labeling, right? That's for sure, because you don't have these models at home. You'll have pictures, yes, but guess how many pictures are on the tests? None, right? Well, you have some lab, you have some lab stations where you see the models, but what I'm talking about is actual pictures, right? You can study pictures, yes, but there's no actual pictures on the test. You have to know the model. That's what you need to know. Many people try to learn this material by only looking at pictures, and that only helps you get the idea, right? But what you really need to know is looking at the model itself, not just a picture of the model. There is a difference. I've been doing this way too long to not know that difference. I've been teaching this since the year 2000, so it's a lot of years. God, you know, I've seen people do it many different ways, and the way that works the best is knowing the model. So here's like a nice little recipe. If you can know it on a picture, that's great. That's the first step. Take that, then maybe learn it on your body or the model as well. So three different references: the model itself, on your own body whenever possible, just generally pointing, right, best you can, and then on a picture. Do it in 3 different ways. Don't only learn it in one way. That's what you need to do. So on page 47, all of our bones are listed. There is a chart on page 47 that kind of gives you explanations of some of these features on the bone, like a tuberosity and a trochanter or tubercle. We're going to be learning those one at a time. It will not be necessary for you to memorize that chart. That's not the point. It's just that if I mention a notch or a condyle or a process, just casually glance at what that means. And by the end of our time, you know, covering all this material, you'll know what they mean, but you're never going to be asked specifically what is a tubercle. You're going to be asked where is the greater tubercle of the humerus, that kind of thing, right? So just knowing that a tubercle is a bump is good enough. A notch is going to be like a small depression in the bone, right? So some of these do make sense. But what we're after, our key objective is to name the bones and to name certain landmarks in the bones, which you'll see is on page 47 in parentheses. Take, for instance, the occipital bone, which is going to be one of our bones, the back of the skull. It has 2 specific landmarks that we have to know, the foramen magnum and the occipital condyles. So note that 4 of these 10 main bones, 4 of these, and I'll write them on the board actually, are going to have specific, well, actually they're going to be on the PowerPoint, specific landmarks that we have to know. So that's another thing. And then we'll get to the muscles after that. So here we go. Here's all of our bones at one time. We're going to focus on 10 of these main bones. Now your skulls are not color coordinated. I realize that, but it does make learning the bones a little easier, I guess, at first, to see the different colors. So I will send you this picture. It's in your lab PowerPoint as it is. So maybe, yeah, as a first step, it might be nice to learn them like this with colors on. It'd be so cool if we could. You can't tattoo your bone, but I guess no one would ever see it. But that'd be cool if we had color bones. It really would be. Anyway, we'll have to name these 10 bones. Here we go. Okay, we'll come back to this picture. Here's the main 10, guys. This is what I would normally write on the board, but it's just easier to put it right up on the screen. So I like to put them in pairs. So if you need to take a picture of this slide, just to, take with you as one of your little study goals, I need you to know these 10 bones. For sure. There's 4 other ones that we're gonna look at, but these are the primary 10 you need to focus on to start off. So here you go. You can use your model. Actually, let me use yours first and I'll. Good. Okay, so of the skull, we're missing the jawbone. We'll just jam it in there. Okay, so frontal in the front. Occipital in the back. So I'll put these in pairs because it's just easier to learn in pairs. It really, really is. Over the years, I've just found this out. So frontal occipital, so front and back. So put this on your front forehead and the back of your skull. Frontal occipital, right? Temporal parietal, next to. Temporal is actually going to mean right here, right above the ear. So right above the ear hole, that's your temporal bone. The flat part of your skull is temporal. And then parietal is up here. The crown of your head is parietal on both sides. So temporal, parietal, frontal, occipital. Frontal, occipital, temporal, parietal. Right? And then sphenoid, ethmoid, these are the toughest ones. Sphenoid is actually where we call our temple right there. That's the weird part. It's not actually the temporal bones. The temple is actually the sphenoid bone. It's only called a temple because you'll see on a side view, most other bones come to meet at the sphenoid. So it's like a temple, meeting place. Right? So your temple right there. That's your sphenoid bone right there. On both sides. And if you could take your fingers and take your eyeballs out, you don't have to do that this class, but if you could put your eyes at the back of your eye socket, that would also be the sphenoid bone. So we're going to know the sphenoid is the back wall of the eye socket and on the side right there, on each side. Ethmoid is going to be on the inside of the eye socket, right there. So put your finger on the inside of the eye socket, that's your ethmoid bone. Or if you could take your nose completely off, there where your ethmoid bone would be, right behind the nose. So which bone, here's like a little twist. Here, which bone would be concerned with smell? Ethmoid or sphenoid? Ethmoid. Which bone would be more concerned with sight? Sphenoid, because the location behind the eyes and around the eye. That's like a little twist, because we're going to see some nerve fibers that pass through the sphenoid that go to the eye. We're going to see some nerve fibers that go to the ethmoid to get to the nose. So relate ethmoid with smell, right? Sphenoid with vision. That's going to be a good thing to do. Ethmoid smell, sphenoid vision, right? Now the easier ones, mouth is above the mouth, mandible below the mouth. Mandible is the jaw. Maxilla is the roof of your mouth. Mandible is the bottom. And then we miss these two. Zygomatic is the cheekbone. Nasal, of course, is the upper part of your hard part of your nose right there. Not the bendable part, but the upper part, the hard part. So here's the 10. Frontal occipital, temporal parietal, sphenoid at the temple here, ethmoid, the inside socket of your eye, zygomatic, nasal, maxilla, mandible. Right? See if you can do those 10 on the skull and on yourself. Go for it. Sphenoid is the temple.
Is it also down?
It's the back of the socket. Yeah, you can't really put your finger there.
So-
Just the temporal is above the ear. Temporal right here is the flat part of your skull. Sphenoid is here. Ethmoid is on the side.
I can, so that's a G. Yes, that's. So for this.
But also the back of the eye.
Oh, right.
And then.
Wait, remember?
Like, that's, but also your translation. Oh, and then your down was like, right.
As long as here and where else?
Behind those.
Behind.
So it's actually, you're doing this, which is correct.
Yeah.
But realize it's one bone, it's just behind the nose. Just can't see it. Fully behind
Yeah.
That's enough.
It's in there, behind your eyes, and it's right here.
Yeah, but it doesn't go back here. Though.
It's like in
It
there.
stays. It's across the back of the eyes.
So
So
like
this
straight
and this is the same bone, just on the back wall.
Okay, yeah.
Yes.
So,
So if you could slide it in and out,
okay, yeah,
it goes behind the eyes, yeah,
that's fine.
right, right.
That's one. And I got
Yeah,
that one.
you best see another picture, which will help. Okay, so on a side view, guys, do your best to find you may not be able to do all of them, but do your best to find them all here on this picture. Yeah, we can see the F1, so there it is. Yeah, you can see all of them. There you go.
Yes.
Okay.
I just.
So find all 10 bones here.
Oh.
So notice the maxilla makes most of the face. The zygomatic is clearly the cheekbone, right? Mandible is easy enough. The temporal is all this area. So the whole flat area where you rest your head at night on the side, that's all temporal. The crown is the parietal. Frontal is the forehead. Occipital is all the way in the back.
Yeah. It's that word that's inside. Yeah.
Okay. Any trouble with those 10 on the model? Is everyone successful on the model with those 10? I mean, you see how the lab tests go now, right? So imagine a skull at a station. You'll be asked any one of those 10, right? No problem? Okay. Now, this is with a closed skull. Now we're gonna kind of open it up and see where these bones, what they look like on the inside. But notice that 4 of these have an asterisk next to them. Occipital, temporal, sphenoid, ethmoid, those are the 4 bones with an asterisk that we're going to pick on to learn some extra features that they have. And these features that we're going to look at will have certain functions, like if it's a hole, a nerve might be coming through the hole, so I have to know, what's going on there. Or it might be an attachment for a muscle to the skull of some kind. So all these landmarks that we're using on these 4 bones only, all these landmarks will have a function. So for these certain landmarks, you have to know what bone they're on, right? The name of the landmark, how to spell it, and then of course what the function of it might be. So here we go. The frontal bone is just it. It's nothing else to know. just the frontal bone. So that's easy enough. The next bone, the occipital bone, it has a couple of features that we should know. And these are the ones. We need to know the foramen magnum, which is basically Latin. Magnum means big, foramen means hole. This is a big hole in the bottom of the skull. So turn over your skull to the bottom. Look for that large hole in the bottom. That is the foramen magnum. What passes through it? The spinal cord. So your brain will become a brain stem, and the brain stem becomes the spinal cord, and that runs all the way down, of course, your spine. But there you go. Again, for these landmarks, you got to know three things. You got to be able to ID the landmark, right? Know that that's the foramen magnum, how to spell it. Know what bone it's part of. In this case, it's the part of the occipital bone. And number three, know what it does. It allows the spinal cord to pass through. Let me borrow your skull again. I should have gotten it wrong. So it's just a big hole. If this was a question on your lab test, and I had, you know, if there was a Q-tip or something passing inside this, it might say, "What is this?" Please don't say Q-tip, because then I hope to mark it correct, because it is indeed a Q-tip. No, you want to say foramen magnum, right? Or it could say, "What bone is this on?" And you'll say occipital bone. Or instead of naming it, it might say, "What is this used for?" And you would say spinal cord passing through. Okay, so those are the three examples of those are the examples of what to expect. All right, next up, the condyles, these little round bumps. So feel for around the perimeter of this hole. You'll feel two bumps. Yours might be a little flattened on that model, but these two bumps are called condyles. And then what's important about those, this is where C1, the first cervical vertebra, will attach to. It'll join with the skull. So you don't know anything about the cervical bones possibly, but once you look at the anatomy, you'll notice, oh God, this person is way out of adjustment. There we go. That'll be $185 right there. Okay, so there's our occipital bone. There's C1. C1 is the first bone of the neck, and it basically cradles the skull to sit on top of it. Right? So the condyles articulate is the right word, with C1. The condyles will articulate with C1. That's what's important about them. Okay. And condyles are always going to be like a smooth, round bump. We're going to see a few other condyles around the body. For instance, check it out on the femur. See these big round knobs at the end of the femur, like what a dog would like to chew on? Those are also called condyles. So condyles are going to be rounded, smooth, rounded edges. Why would they be smooth? Because we've got some movement going on, right? There's also going to be some cartilage on top of those condyles for the movement. So when you go like this, that's the movement of your occipital condyles on C1, this motion like that. Okay. Next up, the temporal bone. We want to know this one right around the ear. We got a few landmarks. The primary landmark is going to be that mastoid process. So find that on your skull right now. It's that big bony process. When I say process, it means something that sticks out right behind the ear. So as long as your finger's behind your ear, you're feeling the mastoid process. So you should know this is on the temporal bone, right? That's one thing. You should know that's called the mastoid process, and that's an attachment for this muscle. For right now, we're just going to call it the SCM muscle. It's an abbreviation. We'll learn the muscle in just, a little bit, but right now it's an attachment for a muscle and it's abbreviated SCM. If you want to know where the muscle is, this muscle right here, right? When you turn your head to one side, it pops out on the other side. So you feel that tendon right there. Trace it all the way back and go straight to the mastoid. So kind of like diagonal across the front of the neck. These are the two muscles right here that pull on your mastoids down to make your head flex like this. So this is how your muscle goes, this is how your skull goes into flexion. When you bring your head down, it's the two muscles, the SCM muscles pulling down on the mastoid, bringing it down. That's what's important about the mastoid. So when you have a headache, a lot of times you get tension, at that area, or certainly whiplash, you're definitely going to have tension there at the mastoids. So that's an important point to know. Sinus trouble, headaches, all tend to infiltrate pain right there at the mastoid. So if you're into massage therapy, that's a hot point for a lot of good relief if you can work on the muscles around that area. Okay, next up we have the mandibular fossa. All that is, guys, a fossa is like a socket in this case. It's a shallow area. So if I were to give you jawbone fast. If you're looking at the jawbone where it's attached to the skull, here's the socket. Look at where this is another condyle, by the way, on the mandible. That mandible will need to fit into a socket in the skull, right? So feel for that little depression in the skull where this condyle fits into. That's the mandibular fossa. So the best I can do is point to it right there. Or if you know where your ear hole is, right? Come just in front of your ear hole. Lightly press, don't press hard, please don't, because you could really mess up your jaw if you press too hard. Lightly, just touch right there and open up your jaw. You can feel that jawbone moving around. That's the mandibular fossa that you're pretty much feeling. You can't get your finger all the way in there, but that's where it is. So if your jaw is out of line, if you compare one side to the other, you're going to feel a big bulge on one side. That's the side that's out of socket. And if you have that problem, and an adjustment could help that, yes, but a lot of people have uneven jaw joints because people, clench their teeth at night or at their boyfriend, spending too much time on Instagram, I guess. Anyway. Next up is the external auditory meatus. Number 3. This is just the ear hole, ear canal. So we'll get to that one later. I'm not really worried about that one so much. These two in bold are going to be the primaries. And the only reason for that is because the meatus is going to be more relevant when we study hearing. Okay. So there you go. So far, let's keep a little inventory here. There's your 2 landmarks for the occipital bone. So work on those. If you've done your work enough on the models, then it means that you might be able to sit and close your eyes, like while you're driving or something, and think about where these, I'm just kidding. Think about where these landmarks are. Just make sure you're paying attention. Visualize where these are. Visualize yourself labeling the model with your fingers. That's what I'm trying to say. If you do it enough in class, then at any point at home, you can think, okay, where is that foramen magnum? It's that little hole at the bottom, right? Where's that mandibular fossa? Right there. So try to imagine yourself doing this. As a great way of studying also. A 4th good way to do it. All right, so those are our 4 so far. Then we have the parietal bone, nothing special there. It's just a big bone, right? Crown of the head. It does tend to join with other bones that we'll get to for the sutures. But here is the sphenoid. This is one of the tough ones, guys. The sphenoid is actually one solid bone. So you're touching it here on the right side, here on the left side, but realize it's one bone that goes all the way across the back of the eyes. So in this view, this is a superior view. If we take the top of the skull off right here, we're looking into what's called the cranial vault. So we're looking down into the skull. There's the foramen magnum again. Now we're seeing the full view of that sphenoid from the top. Two important points are going to be the very, very center, which is the cella turcica. It looks like a little half pipe if you're a skateboarder. A little, they call it a saddle, but a Turkish saddle is what that translates to. And what's in that little saddle? Little bitty, pea-sized pituitary gland. So if you have an extra pencil eraser or something floating around, then you could put it in there and pretend that's the pituitary gland sitting in the cella turcica. It's well protected there. Very important gland, the pituitary. So you'll have to know how to label that, what bone it's on, and then what is it for? It's for the pituitary gland. Our next one is going to be the optic canal. This is number 3. Look at the tiny little holes. Looks like the eyes. Some people say this looks like a little stingray or something, right? Or a bat. Look at the 2 eyes right there. The 2 tiny little holes. Those are 2 optic canals. If you put your Q-tip, if you've got one in your kit, if you put your Q-tip in the optic canal, it should come out, you know, through the hole, through the eye, just like that. Let me borrow your 2 Q-tips. Yeah, that's good. If you put them both in, notice how they crisscross, guys. They come out both the eyes, right? These are going to be your 2 optic nerves as they pass through the optic canals. And yes, they do indeed crisscross on top of the pituitary gland. So you tell me, could a pituitary tumor, an overgrowth of the pituitary, could it cause a visual disturbance?
Yeah.
Yes, because the pressing on one of these are both nerves. Right, so you have to know where the optic canals are and what do they carry? Not Q-tips. They carry optic nerves. That's right. And that's for vision. We'll talk about other nerves too, but these 2 optic nerves are what help you see. Okay, cool. We're going to learn all about the optic nerve later in Unit 4. But for right now, we should know that they pass through the optic canal, also called the optic foramen, because foramen means hole. Okay, the other one, the number 1, the lesser and greater wings. I'll show them to you. They're there, of course. The lesser wing is, of course, a little cliff of bone on top. The greater is the bigger, wider part here on the bottom. There's no relative significance here for function. They do have some other holes in them, but that's just really a structural feature that doesn't have as much relevance as these other 2 down here. So I'm more interested in these 2, cella turcica and optic canal. Okay, there's one on the front also, the superior orbital fissure. This is going to be where some nerves pass through to the nerves that move the eye. So on the front view, look for that slanted, you know, upper part there. The other one is the inferior. We're just looking at the superior. These are going to carry nerves that help the eye move. And those nerves are going to be 3, 4, and the Roman numerals, 3, 4, and 6. But again, we're going to cover eye movement under Unit 4. So this is, I'm going to save this for Unit 4. Okay? Not right now. We'll come back to that for Unit 4. Focus on these 2 right there in bold. And then we had the other 2 for the occipital bone, the other 2 for the temporal bone. And we'll have 2 for the ethmoid, okay? Here's our 2 for the ethmoid. And this same view, looking down in the skull, we see the ethmoid at the very front, right where the nose would be. So these holes here, and I don't think your models show any holes, do they? Well, there should be holes there, right? There's it's actually 2 plates of bone, right? One left, one right, that come to a peak. It sits like this, like a tent. So the peak right there in the middle, that right there, where they come together, there's one plate there, one plate there. The peak in the middle, like a little shark fin, that's called the crista galli. And we should know that there's holes in each of those plates, and they're small holes, so they call them foramina. And the full word is olfactory foramina. That's a mouthful right there. Olfactory is the fancy word for the sense of smell. That's why I had you guys remember the relation between ethmoid for smell, sphenoid for sight, right? It'll help you down the line to remember these. This landmark stuff, guys, I will be honest, probably the toughest part of this whole unit 2 lab work. You probably never had to look at any detail like this before. And you honestly won't in practice as a nurse. You will not. The only time you mention these at all would be if you're in rad tech, because you'll see some of these, if you work for a specific doctor, you might talk about some of these features, but as a nurse, you'll hardly ever use any one of these in your entire lifetime, unless you're working with a specific practice that does reconstruction or specific, bone pathology for cancer and stuff. Okay, so those 2 are the olfactory foramina. There's going to be little nerve fibers that pass through here for smell. That's the whole purpose. And they'll plug right into the brain. Isn't that cool? Interestingly enough, we'll mention this when we get to the nervous system, but since they plugged into the front of the brain right here, this is where all your memories are. And then it'll actually go to the temporal lobe for, for termination for the sense of smell. But it's interesting that your smell sensation passes through your frontal part of your brain, because that's why smells, trigger certain memories. Very cool like that. The crista galli, we'll need to explain more about that in Unit 3 also, but it is an anchoring point for what's called the dura mater. The dura mater is going to be protective tissue over the brain and spinal cord. So, okay, give me a second. If we have the brain sitting in the skull, the last thing you want is the brain kind of sloshing around, because it is like jelly a little bit. It's like jello, honestly, a little bit. We don't want it moving around. So we want to put a tight jacket on top of it and kind of plant it, anchor it down to the skull. So it's nice and tightly fitting in the skull. So that nice tight fit that we have of the brain inside the skull is accomplished by covering it with the dura mater. It's a tough tissue that anchors the brain to the skull. And one of the anchor points right there at the crista galli, the other anchor point is going to be here at the foramen magnum. Okay, yeah. Question? For smell, yes. Yep, you got it. And sphenoid for sight. Yep. Yeah, when we do our dissection, by the way, we're going to dissect a sheep brain in Unit 3. We'll be able to cut that dura mater and see how tough it is. It stands for tough mother. That's what dura mater means. And it's a tough coating. It really is. Pretty darn tough. All right, there's a side view of both the sphenoid in pink and the ethmoid in brown. And you notice these little holes, these cavities in the sphenoid. Those are sinuses. There's another cavity in on the frontal bone right there. So what we know to be our sinuses are actually just holes in the bone that are lined with, mucous membranes. And for a variety of reasons, these can become inflamed, and then it makes our skull, and head feel like crap, to put it bluntly. That's just an inflammation of those membranes and those sinuses. But we're going to see that later in the PowerPoint. Okay, another part of the ethmoid bone here would be these smaller bones that we see on the frontal view. So this is with the nose taken off, and now we get to see some of those other bones that we have not learned yet on the inside. So we're finished with our major 10. We're going to get to these other 4 that I mentioned. There's just a full view of the ethmoid there. It's the oddest of all the skull bones for sure. Very wicked looking. But look at all the sinuses in it, guys. So when your nose is congested, this is what's all, these membranes that line those cavities there are just fully inflamed. By the way, inflammation, unless it's an allergy, that's different. But all this inflammation that happens when you have a virus or, some kind of a cold, it's there for a reason. It's there to protect your first line of defense. It's from things getting in the body. That's why the inflammation is there to bring more blood flow, more increased permeability of the cell membranes to get the waste out, the nutrients in. So as much as we want to hate on inflammation because it's miserable, it does have a good purpose. We just don't realize it because we feel like crap during the timing of it, but it's your body doing its best, So when you guys get sick, right, don't forget to pat the little body on the back, and say, okay, you're doing a good job there. You gotta congratulate your cells for doing what they can. Just tell them, I'm gonna give you a little something to help with the pain, but thank you for your good work, right? You want to be thankful so they can keep doing their best job. All right, there's your zygomatic bone. You guys think I'm nuts, man. It's true. Okay, let me tell you something. If somebody does something for you, are they going to do more for you if you tell them thank you? Yes. Your body will do more for you, I promise, if you give thanks. That's just how the world works. So zygomatic there, nasal there, all easy stuff. Maxilla, mandible, that finishes our 10. The next few are going to be the ones that are more difficult to find. So here's one of them. This is the lacrimal bone. So look on your skull for that tiny sliver of bone. It's going to be in front of the ethmoid, actually. It is very much a very tiny little rectangle, if you can find it. Just on the inside socket. Ethmoid's going to be behind it. This one's in front. This is the lacrimal bone. These 2 that we see in the nasal cavity, these are called inferior nasal concha bones, concave. If you see these 2 up here, these are superior or middle ones, nasal concave. These are inferior. So to be honest, I'm less concerned of these. They're not as relevant overall to what we study with the muscles, especially. In the center is another one. Looks like an upside down V. This is the vomer bone. So that's 3 of our 4 extra bones. Let's go back. The lacrimal and the eye socket, the inferior nasal concave here on both sides, and then the vomer right there in the center. Incidentally, guys, I didn't mention it, but these 3 right here, this is still part of your ethmoid. These 3 right here in the red color, I guess, in the nasal cavity. That's actually part of your ethmoid bone. But the inferior nasal concave, that's separate, and then the vomer is also separate. The last one is on the bottom. If you take your jawbone off again, you'll see at the back of the roof of the mouth. So if you put your finger all the way to the roof of your mouth, all the way in the back, that's the palatine bone. You could say 2/3 of the roof of your mouth is the maxilla. The other 1/3 in the back of the roof of your mouth is the palatine. Right there. The one below it in blue is the vomer again, but the palatine right there. So yeah, those four, you're likely not able to point to those on your skull, so that's okay. All right. And just an appreciation of 7 bones that it takes to make the eye socket. That's pretty darn cool. But if you got something like this, which of the following bones would not participate in the eye socket? Easily the jawbone doesn't, the jawbone, right, or the occipital. So if you did ever get a question like that, instead of memorizing all these, it's easier to just know what's not part of the eye socket, right? The jawbone and the occipital being easy choices there. Or the nasal. All right, so that's everything. Those are the 10 bones. Let's see if we can do them real fast. And then we'll move to a little something else. So this is frontal, parietal. Temporal is right there by the ear. This one and the pink, sphenoid, right? Nasal and the brown behind the nose. Ethmoid here, ethmoid there. In the green, lacrimal. In the darker green in the nasal cavity, like little green boogers. Inferior nasal conchae. The vomer right there in the center of the nasal cavity at the bottom. Maxilla and mandible. And we don't see the occipital bone on this one because it's in the back. All right, so for this part, we look at the sutures. These are just joints in the skull. So I'll leave you to kind of learn this part on your own at home. It just takes some time to get to know what 2 bones are coming together here. But learning the picture is probably the easiest way to do that. So there you go. This is how to identify the 4 sutures. Coronal, squamous, lambdoid, and sagittal. Coronal is named because that's the plane that it's in. It's in the coronal plane there. Squamous is named because squamous means flat. This is the flat part of your skull on the side. Lambdoid, that's just a crazy one. That one's in the back. Sagittal, of course, in the same plane. Midline is the sagittal suture right here. For the quiz, just be able to ID the suture. But for the bigger tests, at the end, you'll have to know what bones are connected. Yeah. Yeah, for right now, just know how to ID them. I'll have one of these in your quiz. So it's not too bad. The spelling again, do your best. Sagittal has 2 T's, guys. A lot of people like to, it's a soft G. It's not a sag. It's not 2 G's. It's a soft G, so it's 1 G. Okay. And then we'll learn a little bit about the vertebra, guys, and we'll switch to muscles. So actually, why don't we just, because this will take a little bit of time to do that. Why don't we go ahead and switch to muscles right now? Because I need to be able to quiz you on some of the facial muscles. So we'll do spinal column and ribs next class. No big deal. We got time to do that, but we're going to switch to muscles at this point. because we got through the major part, which is the bones of the skull. So go ahead and you can put your skulls up if you'd like and grab yourself what we call a mid-sagittal head over there. And we'll work on these. Yes, you're good. You're good. Okay. So the toughest part of muscles is really the spelling. The biomechanics for the face and neck are pretty darn simple. A little more complicated as we get into the arm and legs, but since we're just doing the face and the neck today, I'll give you a couple of options that we're going to see for movement. So like I said, biomechanics do tend to get a little more involved in the joints of the arm and leg, but for the skull, it's pretty darn easy. For the face, let's say we're going to look at roughly, I think about 12 muscles, maybe 15 total, but roughly around there. You're either going to have muscles that circulate the eye or the mouth, right? That will help you the eye squint or the mouth pucker, something like that. So that's very seldom we use those muscles. Or if you have muscles above the mouth, those muscles will move the mouth up for smiling, right? Or if you have muscles below the mouth, those muscles will pull the mouth down for frowning. So the number one thing in common of all these muscles is that they will pull. Muscles always pull to do work, okay? And whatever they attach to, they're going to pull it either up or down to the side in any way. So whenever you see a muscle around the mouth, just think of it pulling the mouth up, across, or outward rather, or down. That's going to be the options that we see. And then for the jaw muscles, we're either going to open or close the jaw. The two muscles that we're going to see for the jaw are both going to be muscles that help us close the jaw for biting or chewing. Okay, we won't see the muscles that help us open the jaw, just the ones that close, just to make it easy. So I'll break these muscles off into 3 different slides, just to make it easy to go with. So here we go. Some of these, this is the easiest of the 3. Some of these are named for the area that they cover. So check it out. We have a frontalis muscle that covers the frontal bone. This is basically just for facial expression. It really doesn't do much. We have a temporalis muscle that covers the temporal bone. This is going to be one of our jaw muscles to help us bite or close the jaw. And if you want to test it, if you clench your teeth together, well, first of all, relax your jaw. Put your finger on the temporal area, the temporal bone, and now clench your jaw. You'll feel the muscle tighten up in that region. That's your temporalis muscle. And then we have an occipitalis muscle. So basically, we're just adding a little IS, little Latin flair on the end of these names: frontal, temporal, occipital. Add an IS, and you got the muscle that covers those 3 areas. Okay, those should be easy. So the temporal is definitely the one that has the most function here for closing the jaw. Also the one that's enormously affected by headaches. Usually if you've got a headache, one or both of your temporalis muscles are going to be like, you'll feel like little nodules and little spasms. And if you can dig those spasms out by circulating your finger, it helps to, remedy the headache or the tension. Anyway, okay, so those 3 should be easy. Just find those real fast on your model. I know they look a little bit different or smaller on your model, but do your best to locate those 3 first of all. Then we'll go to our next one. It's going to be actually covering the jaw itself right here. So again, lightly press, don't press hard because you could make your jaw go funny. But clench your teeth with your fingers here, and you'll feel that masseter. It's a big mass of muscle. That's how it's easy to remember. It's a pretty thick muscle called the masseter. Also for the jaw, closing the jaw. So the masseter and temporalis both work together to bite and chew. Then we got these two. The SCM, the sternocleidomastoid, that's the full name. And then the trapezius. Trapezius is the easiest one. It's the back of the neck. So if you do this, this is what you're feeling, the trapezius. Is the one, there's many, many muscles underneath the trapezius that are closer to the neck bones, yes. But this is the one that basically covers your neck and shoulders. So right now, we're just doing the neck, so the trapezius is right here. Once we get to the shoulder, we're gonna see the trapezius goes all the way down the neck, all the way down the back here as well. But the trapezius is right here on the back of the neck. For the biomechanics of the neck, guys, it's really simple. It's gonna be the same for the shoulder and hip. If the muscle's in the front, it's gonna pull forward. If the muscle's in the front of the neck, it's gonna pull the head forward, which is down in this case. If the muscle's in the front of the shoulder, it's gonna pull the arm forward. If the muscle's in front of the hip, it's gonna pull the leg or thigh forward. So that, it's really, really easy if you know it by location. So this muscle's in the back. So what we'll do now, pull it backwards, right? We call that extension. So if the muscle's in the front, it's gonna be a flexor. If the muscle's in the back, it's gonna be an extensor, all right? So yes, you will need to know those two actions. Trapezius as an extensor in the back, SCM as a flexor in the front. So when you get whiplash, if you get whiplash in a car accident, you're ripping up both these muscles. That's why you can't move your neck, because they're inflamed, right? They're torn and they get inflamed. So the worst thing to do, if you do get whiplash, is to start moving your head. Oh, I'm fine. You know, that's a horrible idea. You want to leave them alone for a while. But there you go. That's the simple biomechanics of those two muscles. Trap in the back for extension, sternocleidomastoid in the front for flexion. Okay, moving on. Here's our next one. This is where it gets a little bit more specific. A lot of these muscles have crazy names, but if you follow the, the logic of it, it's not too bad. This one goes around the eye, so it's called oculi. It orbits the eye, goes around, so it's called orbicularis. So this is the orbicularis oculi. I've got the numbers here, guys, which should coordinate with what you're seeing on your model. There's going to be another one that goes around the mouth that we'll see on another slide. But look at this one. Next up is a muscle that comes from the base of the eye down to the top of the lip. Since it inserts to the lip, that means that it's going to move the lip. Labii is the medical term for lip. It's above the lip and it's going to raise the lip. So the name is levator labii superioris. It elevates the lip, okay, for smiling. Can y'all find this one on your model? It's kind of like, I think it kind of curves from under the eye on your model. It's not as straight as what it looks like right there. This is the toughest one, probably. Levator labii superioris. Try to find it for sure. From the bottom of the eye to the top of the lip. I hate to ask, but do you guys know who Elvis is? Okay, good. You know how he used to hold up his lip like that? Yeah, this is like the Elvis. Sometimes it's called the Elvis muscle. But it is a muscle that helps you smile. Then we have this easy one, zygomaticus. Again, all we're adding is a little something on the edge. There's the zygomatic bone. Everyone knows where that is, right? So now find the muscle that comes from the bone, the corner of the cheek, right all the way down to the corner of the mouth. This is the one muscle that you should use as a reference point, because you always know where that cheekbone is, right? This is the one that comes right off the cheekbone, zygomaticus. So as a strategy, if you know where zygomaticus is, come a little bit closer to the eye and you should be able to find levator labii, because we're really only working on those two. So don't get these two confused. Usually half the class gets these confused. So it's fix that, right? You can be the class to fix that for me. The last one on this slide is the buccinator. The prefix buccal or buck right here means cheek. So right in the center of the cheek, the buccinator. This is not really a facial expression. This is for tone of the cheek. So if you've got a mouthful of food and you're moving it around, this is what helps do that. Or if you play the flute or the clarinet, any kind of tone, muscle tone you get in your cheek, that's the buccinator. So it's used to move food around or compress the cheek. But it's right in the middle of the cheek, right there. Our last slide here. We got that orbicularis oris around the mouth. Again, oris meaning mouth. Now we have a depressor labii, which means it's going to be underneath the lip if you follow the logic, because it's depressing the lip. And if you'll notice, these two muscles are both in line with each other. Check it out. There's your levator labii, and there's your depressor labii. One's on top of the lip, one's on the bottom of the lip. The one on top smiles, the one on bottom frowns, right? It's just a lot of words to put in there to name it. The risorius is the muscle on the side of the corner of the mouth. Find that one, guys, coming right out to the side. That's risorius. And then right in the center of the chin is mentalis. So obviously it's going to take some time to master these. Yes, these will be on the quiz. A few of them. I can't ask all of them, but probably about 2 or 3. But here you go. You have the PowerPoint. I can send you some pictures to help out, though. This is everything. If you put it all together, it makes you want to run, doesn't it? So there's everything unlabeled. All right, let's give it a shot. Frontalis, temporalis here, occipitalis there. So frontalis, temporalis, occipitalis, orbicularis oculi, levator labii, superioris, from the cheekbone, zygomaticus, the middle of the cheek, buccinator, on the side of the mouth, risorius, below the mouth, depressor labii, right, inferioris, at the chin is mentalis, around the mouth, orbicularis oris. We did not do these two at the very, very bottom. We could skip those. But the last two, we had the sternocleidomastoid. Notice how it goes to the mastoid, guys. Trapezius in the back. And then masseter right there on the jaw. So I know it takes some practice, but there you go. There's your muscles of the face. We will work on bones and muscles of the thorax and spine on next class, but this is what's on your quiz. You'll probably have this right here, labeling the muscles. It'll be on the screen, by the way. The quiz will be, I'll show you a picture like this, and you'll label it, whatever I ask for. So the bones and muscles of the skull and face, and then probably you remember that picture I drew of the bone, all the parts of the long bone? Probably a picture like that to label. But I'll send you an email to confirm everything for the quiz. All right, y'all.
So could we be in regular questions?